A unique partnership between NUI Galway and Galway University Hospital is helping patients find technological solutions to clinical problems. Derek O'Keeffe is a physicianeer, a dual-qualified physician and engineer who trained in Ireland as well as in the United States at Harvard University and the Mayo Clinic. Derek and researchers at the HIVE Lab in the Lambe Institute identify clinical needs and use state-of-the-art technology to develop innovative patient solutions.
So the secret sauce here is having other people with skills and strengths and passion in this area beyond what traditionally would be there. This is where we do all our exciting research with state-of-the-art technology such as AI, robotics, HoloLens, and lots of other novel solutions are developed here for clinical problems. So in the HIVE Lab, we have computer programmers, we have electronic engineers, we have psychologists, we have educationalists. Everyone is at the table, all giving their skill set to make a solution that really works.
Hello, welcome to HIVE Lab.
Dave is one piece of technology that is helping Derek and his team deliver care to his patients who suffer from diabetes, a chronically debilitating condition that can be life-changing for those who develop it.
Dave is the diabetes audiovisual educator, and it's an innovative idea. We're going to use robots to deliver healthcare information to patients. Diabetes is a significant burden on humanity. About 600 million people have diabetes. That's about 1 in 10 people. And in diabetes, the two main types are type 2 and type 1. Type 1 diabetes affects about 10% of people with diabetes, and it usually comes on earlier in life. It's an autoimmune condition. Type 2 diabetes is associated with older, middle-aged life and sedentary lifestyle.
Mark Cahill and his daughter Abigail from County Tipperary are regular visitors to Professor O'Keeffe's clinic.
Abigail has type 1 diabetes for the last 10 years now, and she struggled like everyone does, trying to get the balance right between taking the carbohydrates in your food and calculating how much insulin you need.
Like the ability to fully understand what's going on. You arrive in hospital, you're told you have something. I didn't have any clue what I had. I was only 7 at the time, so everything affects diabetes, your mood, even just the weather. If it's hotter, you'll go lower. If it's colder, higher.
Type 1 diabetes is something you have to think about a lot. If you think about food, you go to a restaurant, you have to think about the food there. You eat at home, you have to weigh out or at least assess how many carbs are in a particular meal. We regularly visit this hospital, but we're meeting new technology. It's an interactive robot. We haven't met him before, so it'll be interesting to see what it's about.
Nice to see you, Abigail. Take a seat there. Nice to see you. Hi, nice to see you. Take a seat there, yeah.
Thanks very much.
Your annual review this year for hypoglycemia management, going through all the rules and so on, will be done by Dave rather than myself or by Helen. If you come over here, so. If you were to add up all the time that Abigail sees a clinician like myself or a nurse like Helen or the dietitian, the podiatrist in the whole year, it's probably only 8 hours, that physical contact with us.
Hello, I am Dave. Nice to meet you. Would you like to learn about diabetes disease and management?
Yes.
Yeah.
Yes.
Thank you. Let's get you started. Would you like to get seated?
So we want her to have the life skills to be able to manage diabetes without us. The technology that she wears and employs is part of that solution, but the bigger part of the solution is the education.
Would you like to learn about managing hypoglycemia, how to use glucometer?
We're very eager to find out, is that a good surrogate for a human teaching them? We're trying to bring in assistive technology into our practice that complements us rather than competes with us.
Another piece of important technology that is helping diabetes patients is being developed by the HIVE team.
We in the Diabetes Day Centre developed a mobile application that encompasses multimodal learning to teach carbohydrate counting in conjunction with the education they received with the dietitian. Basically, it helps to teach carbohydrate counting, and we're just looking to get some feedback from some of the patients here on how they like to use it.
Okay.
That'd be okay?
With Abigail and Mark, they're part of our PPI group, our Patient Public Involvement in Science group. And so they're actually at the table with the engineers, the psychologists, the educationalists, the programmers, the clinicians. They're all there with them.
and you just touch on each picture that you want to learn something more about.
Nessa Keane works in diabetes and endocrinology, but she is also interested in harnessing the potential that digital medicine offers.
What excites me about digital medicine is we can offer patients more opportunities from a clinical point of view and from a patient care point of view than we could previously.
And is there a scoring system afterwards,
or is it
just to build your memory?
It's to build your memory, yeah.
Okay, yeah. Leaning on the technology gives us confidence. That confidence then, enables us to do things that you wouldn't normally do. I mean, as a parent, I'm growing my kids to be independent, and through these technologies it can help.
This technology definitely has been life-changing for just me, my parents, the whole family routine.
And ironically, it's changed us so that it's bringing us to normal, which is, what you want and what you want of your kids.
One of the HIVE Lab's most important collaborators is patient Sinead Hanrahan from Loughrea in County Galway, who has battled with the effects of diabetes since she was a young child.
When I was 12, I was diagnosed with type 1 diabetes, but as I got older, they realised that a lot of my family have the same type, and it was kind of rare that so many people in the one family would have it. So they actually diagnosed me with MODY. It's a mature onset of diabetes in the young, so it's kind of in between a type 1 and type 2. So I've had that now for almost 10 years.
Graduating from NUI Galway with a degree in nursing, Sinead became an emergency department nurse in Galway's University Hospital. But as the effects of her diabetes worsened, she lost the sight in her left eye.
In December of 2015, my right eye went fuzzy as well. Kind of in December when they said it would be a similar situation, I kind of knew for a while I knew before the surgery that it mightn't go to plan, and it didn't. So then I just woke up and they were kind of saying it didn't work, and I just said, am I blind? And they were like, yeah, and that was it.
You know where the steps are. No worries.
Sinead mentioned to me that she had recently now been fully registered as legally blind and was finding it difficult to navigate her world, especially being so young. She was quite active still and wanted to still engage in society. But an interesting thing she said to me was that she didn't like using the white cane. She said to me, we've had a white stick for hundreds of years. Surely with all the technology out there now, someone come up with a better solution for it.
When I first went blind, that was a big thing, was self-conscious, like, oh God, everyone's going to be looking at me, and I know they wouldn't, but in my head I was like, oh, they'll see the cane and they'll just be like, oh, the poor girl, and I just didn't want that,
And that planted the idea in my head then of developing this electronic device that would give you navigation feedback through haptic vibration, which started off as the Jedi glove and has now evolved into the HapNev.
Sinead is back in Galway to discuss the latest stage of the design. Local medical device designer Roisin Nolan has been collaborating with Sinead, along with engineer Musam Hassan, who helped develop the technology in the original glove.
Sinead is my inspiration. She's the person who needs this. So what we're trying to do is we're trying to make a wearable device that's user-friendly for Sinead. And I've gone out to Sinead's house and she was telling me, simple things like trying to go out and put recycling in the bins, and she's having to kick with her feet to kind of find where the bins are because she can't see them.
It's good to give a bit of input and change what works, I guess, for me and for any other visually impaired person that would be wearing the watch. So yeah, it went from the glove and then the HapNav. And it's just nice to try it on and tell her what feels good, what way to hold the hand, like what way I naturally hold my hand, and changes like that.
Okay, here you go. So Sinead is central to the design because she is the person whose needs we need to meet. And if we can meet her needs and make it useful, then it'll improve her quality of life. And that is the ultimate aim of what Professor Derek O'Keeffe, myself and Musam are all working towards. We're trying to make people's lives better.
Over the following months, the HapNav collaborators have been busy integrating all of the necessary technologies into the latest design. The team are now back in Loughrea.
Ian has arrived from Dublin and he's been brilliant. He's designed the electronics, and we've miniaturized the device from the Jedi glove and we've made it into this small little wristwatch
so I can virtually see you because this is buzzing and telling me that there's an object in front of me. Hi, Sinead. Hi.
The day has finally arrived for Sinead and the design team. If successful, the HapNav device could be an important step closer to Sinead's independence.
With electronics and software, you can do things that you just can't do with any other technology. It's the technology of sensing, and then the technology computing, and then the technology of feeding that back to the human.
When the HapNav device senses an obstacle, it emits a vibration which gets stronger as it nears that object or surface, helping Sinead build up a spatial picture of what's around her.
I think I'm near them, but I just go a bit further.
There's a big intellectual input into this project, but also an emotional impact into this project, as you've seen from the design team. We've come with Sinead on this journey to design something that's useful to her in her day-to-day life, and the reaction today certainly is that it will be very useful for her. From here now, we want to bring this idea forward to the wider community of people with impaired vision, to let them use this straightforward device that's easily worn and used as part of their daily life.
Yeah.
Oh, excellent.
Yeah.
Good job.
That was brilliant. Oh, do you know, the feeling, literally the feeling for Sinead, to see her reaction there, to see it working, it just filled me up with, like, I'm just so pleased for her, because she was the one who said, Derek, I hate that cane, can you try something else? To actually have the thing come together today and Sinead using it, it just blows my mind. And now to see her actually go around the side of the house without having to touch it or use a cane and have this tiny little device on her wrist, and it's just like, it's just mind-blowing, it's brilliant. It's just fantastic to see it, and she's so pleased. That's the main thing, you know, she's so pleased. Ah, yeah. It's brilliant.
I feel like if I got a guide dog, hopefully that I could use both together, because, you know, the guide dog would be at the left and this would help on the right as well. Well, it's something new, and I suppose it's like a step closer to a bit more independence. It's another aid to help me with my mobility, not to be relying on people all the time, and I can do my own thing.